Hello, my name is Cecilia Lamin. Welcome to my care coordination presentation to colleagues in class NUIS FPX 4050. Nurses coordinate care by guaranteeing patients receive complex, integrated, patient-centered services. There are approaches in care coordination touching on patients and families, change management, and ethical decision making. This presentation will therefore look at various strategies that have been put in place to improve patient care and mobilize the patient. The patient. Sample findings showing the relationship between the strategy, the patient outcome, and patient experiences, as well as the role of nurse in this process. The given principles, when applied, will make it possible for nurses to deliver quality care, satisfy more patient demands, and consequently have healthier clients. The concepts described within the session will concern this significant issue and further discuss possibilities for maintaining effective influence on patients' lives by the healthcare staff. Strategies for collaborating with patients and their families. Drug-specific educational intervention is one of the most effective approaches for increasing collaboration. Patient enlightenment makes them aware of their medications, objective, dose, and complications, which benefits treatment compliance. It means that when educational materials are produced for such patients, it is essential that they are prepared in simple language with illustrations. This way, patients and their families become responsible for the medication process through the use of available resources. Medication management plans are a crucial element of collaboration. In cooperation with the patients and their family, we've developed a particular patient plan discipline depicting the timeable instruction and necessary tactics for appropriate medication intake. Such plans can also entail valuable items such as pills box or phone alarm clocks to alert the patient when it's time to administer the dose to avoid non-compliance. Cultural sensitivity is crucial to collaboration with patients' loved ones. Family engagement is critical in care coordination because families supply much needed love and help in caring for their relatives. The family involvement in the patient's care implies that they should be part of any significant decision made for the patient, thus organizing family meetings to go through the patient's progress and agree on future strategies, assist in keeping the family members updated and included. Therefore, engaging those makes them feel essential and allows them to participate in delivering care service to the elderly. Aspects of change management affecting the patient's experience. Of all the elements of change management, communication has a direct bearing on the patient experience. Effective and organizational communication between healthcare providers and patients is vital to maintaining and improving trust level and patient comprehension of their healthcare choices. Another change factor that influences the patient experience is integrating the theme of patient engagement within the healthcare setting. Patient advocacy stresses a response to patients' requirements and desires based on their culture and belief. Thus, seeking patient feedback and integrating it into care processes allows for identifying areas of improvement and implementing corresponding efforts to improve the situation. Such responsiveness also means that the healthcare system is sensitive to the patients and their needs and fast to adapt to changes. Patients enablement and patient involvement are other areas of change management that encompasses the patients the patient. Patient engagement include educating patients, providing information and supporting them to enable close involvement in their treatment plans. Activities in managing change should target the patient's self-management confidence as the backbone for any change strategy. These empowerments improve the patient's status and contribute to strict compliance with the suggested therapy regimen and effective results. Rationale for coordinated care plans based on ethical decision making. As one of the aspirations of the ethical approach to care plans, the patient's rights to self-determination via autonomy necessitated the participation of ethics in developing coordinated care plans. Through ethical decision making, there's enhanced patient involvement in the health planning and management processes. Such participation includes educating the patient about the treatment available, the drawbacks and advantages, and thus allowing the patient to make choices that reflect the patient's values and preferences. Another simple moral ethic applicable to coordinated care plan is the ethics of beneficence, which is the coordination of doing good to the patient. Integrated care management plans are meant to ensure that the patient receives services across different care settings and from various providers and provided optimally. Ethical decision making involves constantly comparing the advantage and disadvantage of patients' interventions to get the best results while doing as little harm as possible. Justice is another vital principle in ethical decision making because it concerns fairness in providing healthcare services. Many ethical considerations in coordinating patient care ensure that all patient care is equal, regardless of social class, color, or race. This equity aspect entails recognizing the existence of unfair treatment in providing care to patients and knowing that it's up to one to stand for those patients to receive the required services. The other critical ethical consideration that can be applied in formulating strategies for caring coordination in non-maleficence, which means that one should not harm the patient. This principle directs healthcare providers to critically assess possible hazards in connection with the diagnosis, treatment, and management of clients and patients, and the outcome ought to be beneficial rather than undesirable. Since the patient care coordination contains multiple healthcare themes, the plans are designed to prevent errors and adverse effects. Some critical assumptions that one can also apply in ethical decision making concerning coordination care plan are that every individual has basic human dignity and worth, and that as providers we have specific moral responsibilities to acknowledge such principles. It is important to know how these assumptions inform the types of care delivered, focusing on humane and ethical standards. Coordinated care plan strategies must be more patient specific because ethical implications cut across various treatment programs. Residents have confidence in ethical care. The facility enjoys a good image, increasing overall credibility. Potential impact of specific policy provision on outcome and patient experience. An essential part of the overall healthcare policy is the Affordable Care Act provision that directly affects patient health and perceptions. By increasing the coverage of previously uninsured individuals, the ACA will enhance the population demand for the required medical services. Increased access equality positively impacts patient satisfaction through self-referral, since the low cost is pulling factors to prompt people to seek medical assistance when sick instead of postponing the trip to a health facility. Another policy provision is the Hospital Readmission Reduction Program, the HRRP, which also affects patients' outcomes and experiences. Thus, by penalizing or reducing payments to hospitals with relatively high readmission rates for some conditions, HRRP prompts healthcare facilities to employ discharge planning approach to reduce readmission. This focus on decreasing readmission improves this focus on decreasing readmission improves patient satisfaction and recovery by maintaining patient follow-up and detecting possible emerging issues before they require hospital readmittance. The role of nurses in care coordination. Another role that directly related to the coordination of care is patient advocacy, a significant duty of the nurses. They are in the best position to appreciate and comprehend the patient's characteristics, such as needs, preferences, or simply fear and anxiety, and that is why they take care that the comprehensive treatment plan matches the patients. Nurse advocate for patients' needs so that other healthcare providers can hear them and make care decisions. Nurses also actively promote communication among the member of the multidisciplinary healthcare team. One is to act as a communication center where physicians, specialists, therapists, and other healthcare providers involved in patient treatment are informed of the specific information they need to know. Education is another aspect of care well coordinated by the nurse, since they must ensure that the patient and their family understands the detail of their illness and the treatment procedures. Thus, the knowledge and skills that nurses teach patients and families assist the client in adopting best practices for managing their health. It encompasses educating the patients on medications, diet changes, and other practices that can help manage diseases. Among other aspects of patient education, knowledge impact on prescribing enhance patient involvement in the care process themselves, thus resulting in usually positive compliance with their treatment plan. In conclusion, coordination of patient care is a fundamental concept of nursing that relates directly to the quality of care outcomes and patient satisfaction. Thus, nurses can promote the quality and continuity of care by using such strategies as patient and families involvement, changes as an opportunity, and an ethical decision. The Affordable Acts and the Hospital Readmission Reduction Program indicates that both access and reduction in readmissions are aimed at containing cost of care and call for enhanced role of the nurse as the person who promotes collaboration and advocacy. Due to their membership in the healthcare delivery team, nurses are privileged to provide a patient-centered approach, educate patients to participate in decision making, and be receptive to patients' needs in the line of care. Thank you, and this is all for my presentation.